My name is Dr. Aman Setiya. So I'll be telling you something how to deal with the last moment in this before this FMG exam. So I am your medicine faculty at Dbmci. So let us first discuss how to approach the last moment strategy for this exam. So as you all know, we have 300 questions in exam. So what is first and the most important strategy before your exam is take a good sleep. So many students, they make this mistake, that is they are not sleeping whole night. This is a full day session in 2 sessions you are giving exam, so you cannot, your brain will not be active when you will not take a proper sleep. So an adequate sleep is most important. Okay, if I say, like we have paper 1 and paper 2. If I say in paper 1, mostly questions they are coming from pre or paraclinical subject. So generally it is seen in 90% cases paper 1 is composed of preclinical and paraclinical subject. And if I say paper 2, this is based on clinical subject. So understand this when you are approaching towards this paper. So understand this, if you get questions of like anatomy, micro, biochem, physio, patho, pharma, forensic, these are generally seen in paper 1, PSM. If I say paper 2, you will see clinical subjects like medicine, surgery, OBG, radiology, dermatology, pediatrics. So just my take home message is, this is your time. Follow this, you will get a break. In this break, so make a smart study plan. Like I know, like we are left with very few days or few hours before your session. So this break is for you. Do not make unnecessary discussion in the break. If you see paper 1 is already having anatomy, micro, biochem, focus, try to revise the difficult topics, try to revise the things which you can forget before paper 2, like try to revise some topics of medicine or gynae. Okay, if I say what else we can do is, there are something, this is a screening exam, so this is different from PG. So just I want to tell you, this is number 4, this is a screening exam. It is not a competitive exam. Here you want to get 150 marks. That's it. So if I say 150 marks you need out of 300. So this is the only exam where you can make 150 mistakes of your life. So mark my word, 150 mistakes are allowed. Only exam which is giving you permission to make 150 mistakes. So what is human nature? Human nature is like, this is a licensing exam, so this will have more pressure for FMG graduates because this is their career deciding exam. Okay, so what I suggest more is, this is only exam where you can make 150 mistakes. So how to approach the exam? When you enter the exam hall, just take care you are not wearing any kind of ornaments, or jewelry, right? Or anything like I can say earrings or chain or pendant. So just keep these things at home. So do not carry these things with you. If I say try to sleep by 8 o'clock or maximum 10 o'clock. Wake up early like 5 to 6 o'clock. This should be your strategy. Some students, what they do is they are not sleeping, so they will have problem because you are sitting in front of exam. In that exam hall, you will be drowsy, you will be feeling more sleepy. Okay, then if I say how to approach a question up like some time, like many institutes, many coachings, they say that all the things are coming from their notes. But you should understand this, there will be things which will be new, which are expected to come in exam. So understand this, MCQ solving is also an art. You should be knowing that art to solve. So if I say, suppose in paper 1 you are getting first question wrong, second question is wrong, third question is wrong. So what happened with the student is, being a student, I have noticed this thing to myself is, then fourth question is simple question like Down syndrome is at which chromosome? The answer you know, it is chromosome 21, still we mark the answer 18 or 13 or anything else. So fourth question is a silly question that we make a silly mistake. So this is like a form in cricket. You are not playing, you will be out in a loose ball. So understand this, you should not lose hope. If 3 questions are wrong back to back, still there are 297 more to come. Suppose your paper 1 is bad, you are having a depressed mood in the break. So what you are doing is focus on paper 2. Don't be sad, focus on paper 2. You can perform. If you are having solid concept, I can assure you, you are definitely performing well in paper 2. So what I want is, this is an era of a smart student, not a hard working student. You should be smart enough. So this is an era of smart students, smart apps, smart technology. So what I can say is, sometime like this is a screening exam. PG exam we have negative marking. Here there is no negative marking. Suppose you are getting options in exam like A, B, C and D. If I say 3 common disease, diabetes, TB, malaria, 4th, Duchenne muscular dystrophy. You are blank in the exam. You are not knowing anything about this question. Pick the answer here 1. Similarly, 3 rare disease in exam. 1 common, you are blank, then go for the common thing. This should be a strategy. So if I say 9th point, if I say what you need to add in this list is, like this is a time like 2, 3, 4 days are left before exam. So what we do is we focus on we try to read all the subjects. To read the things which you think which are important. Read the things which you think you can forget. Read the things which are important and read the things which you think you can forget, and read the things which are difficult to you. So we all are different. We all are different by nature. So we all have a different interesting subject and different difficult subjects. So read the things which are difficult to you. Don't follow that trend like people are studying PSM in the last day, I'll also study. So that will not make a difference. Okay, if I say there will be 300 MCQs in exam, out of these 300 MCQs, there will be 200 to 250 questions. These will be generally from our notes. There will be 50 to 100 questions which might be new. Here you need to apply your knowledge of your medical school. Now some of you are saying we don't have any knowledge in medical schools. That is not a fact. You have something, believe on yourself. Then focus on logic. There are some questions which are logic based. So you can master those questions with the logic used in exam. Okay, what student make mistake is, if I say point number 11, what student make mistake is, many students, especially female students, some boys also, they do have panic attack before exam. They are panicking a lot. They are having panic attack. So they are having tachycardia, palpitation, what to do, my exam is tomorrow. Because they think they are forgetting. Like you are forgetting, all other students, those who are giving exam with you, they are also forgetting the same thing. This is a life of a student. When I was a student, I was also having the same mentality. Before exam, we all feel like we are forgetting the things. Like today we have studied anatomy, tomorrow microbiology, day after tomorrow pathology, then anatomy is gone. So that is for everyone, that is a common thing. So what I can say is, this is world simplest screening exam. where you can make many errors, still you will pass. So what should be your strategy is, many students like nowadays they are giving the new pattern of question, we call them clinical questions. Clinical questions. So how to solve clinical questions? From my opinion, if you are having good concepts, the bigger the question, more, or you can, there is a more chance you will put the right answer on a bigger question, because big question will give you more hint. Rather than a one-liner, big question will give you more hint and you can answer better. If I say how to solve image-based question, again my point is this is a screening exam. So they are asking you images which are important or images which are common. So they are focusing on those images which are common. They are not, or those are important. So you will get a paper from these simple factual based information, like, okay, some students are saying like in my hospitals in Russia, China, Ukraine, I don't have exposure to hospitals. So they are asking internship based question or practical based question. Still you can answer. How you can answer? By using your logic. Still it is not a difficult question, it's still an easy question. So what is my take home message to you is, just believe in yourself. Believe in yourself. So I can say this will be, self-belief is very, very important. Believe, be confident in exam, because this is not an exam for your knowledge. Just by when you are, the more confident you are, better you perform in the exam. So give it like a normal class test. Give it like a normal class test, nothing else. Don't panic much, don't think more. Over stress can burn you out. You can make silly mistakes in exam. Students fail in this exam because of those silly mistakes, not because they are not studying. Okay, if I say the last thing is, when you are having this confidence, when you start believing in yourself, then your attitude toward the paper will change. Okay, if I say, let me say like tomorrow, like if I say on the 12th December we have exam. So you should be going confident in exam. Get yourself well dressed. Look beautiful, look handsome. Enter the exam hall with that confident. Don't make too much discussion of MCQs during your break. So what we do is, what we see, like what I see in exam center is some students, they are scrolling their notes. They keep on turning pages of their copy, books, revision modules, chanting sessions and many things. These things will not help at the last moment. At the last moment, what we need, a good student, a topper student, what he do at the last moment is he make plan. He make plan or he make strategy. The plan is how I will be solving a new question. The plan is how I'll solve a new medicine question, a new OBG question, how I will solve this image-based question. I should not panic if my 3, 4, 5 questions are wrong in a row. I'll not panic if I am not knowing many things which they are asking a new things in exam. So that is a good student, a topper always make a plan. The same plan you should make in the break. So make this plan in the break as well. So sometimes, like mostly it is saying paper 1 is having pre and paraclinical, paper 2 is having clinical, but what sometimes they do is in paper 1 they will keep clinical question. Then your plan should also be changed accordingly. Now you should understand paper 1 already had medicine, surgery, OBG, pediatric clinical questions. So paper 2 will be having pre-clinical. So this is how we approach towards exam. So if I say this last thing is, what I can say is, whatever it is, just give your best shot. Whatever you have, just give your best shot. Whatever you have, just give it with no regrets. There should be no regrets, because no exam, remember, mark my word, no exam entertain any kind of excuses. These excuses are just to satisfy yourself. So go with that belief, try to believe yourself. Okay, most of you have cleared class 10th, class 12th with good marks. 60%, 70%, 80%. Right? When you are not knowing the paper, when you are not having options, when there is no MCQs, you have to write. Do you remember social studies or mathematics of class 10th, or social science, social studies, or science, or Sanskrit, let me say. So these are difficult, these were difficult subjects. In those you have performed better without options. Here the options is just playing hide and seek with you. That's it. Here option is in front of you and playing hide and seek with you. So when you can crack those difficult subjects without any option, you can write 5 pages, 10 pages without any options, then here the answer is in front of you. So this is my review about this paper. Soon I'll be posting the verdict of this exam and the future perspective of FMG exam in future. What are the types of questions they are changing, the pattern. We should go with the pattern, not against the pattern. So there are more questions clinical based and they are expected to come, but you should not lose confidence in this. These are real clinical based scenario that they ask. This is a screening exam, but remember, when it's a screening exam, the paper for screening is easier compared to a paper of PG exam. So what is I want to say is, just many of you are wishing these things, so you wish, or let me say, you are telling yourself, I wish. You should not wish. Tell yourself, I can, I will. You can, you will. We are having a belief on you, and you should also believing on yourself. For any queries, you can ask me at Facebook of Dbmci or Telegram channel of Dbmci or in YouTube channel of Dbmci. So I'm available anytime to answer all your queries related to this exam. I believe yourself you can do. We all are genetically 99.9% same. So you can perform, we can perform, I can perform, we all can perform. So believe, self-belief is more important. So this is a simple exam. Go in exam with a confidence and give your best shot. So this is from my side. All the best to you. Go ahead and steal the show. Bye-bye. Thank you.